terms of the current presentations, which will be on eco-emotions. Eco-emotions, again, a rather new topic, and here we recently have looked into eco-emotions in link to suicidality more, and from the literature, despite there are still quite some debates all around the definitions and even how we call those phenomena. However, it's clear that the most described eco-emotions currently in the literature are eco-anxiety, eco-grief, and solastalgia. Of course, there are mentions of eco-guilt, eco-anger, but also eco-depression. So just briefly, before I say a few words about what we saw in link to the suicidality, that eco-anxiety, as defined by the American Psychological Association, is a chronic fear of environmental doom. So, and it may range from mild stress to clinical disorders like anxiety and depression. And it may encompass very guilt, sadness, and hopelessness in link to the current climate crisis. Eco-grief refers more to the sense of loss that is related with the experiences of learning about environmental destruction and climate change. So it is our concerns and worries about the environment, and it may include loss of ecosystems, landscapes, species, and more widely ways of life. If now eco-anxiety has been more reported among younger generation as being worried about the future, then eco-grief has been more related with the older generation as grieving for the past. And here there is another term, solastalgia, coined by Albrecht. And this is already considered as a specific type or form of eco-grief, which is related with a specific loss. So, for example, your childhood home or your childhood community or village changing because of the climate change. So now, recently, it's still currently under review. We did look actually how much is the information about eco-emotions, suicidal ideation, and behavior. We identified in total with our searches slightly over 500 abstracts, and approximately there were only 20, apologies, I'm lying a little bit at the moment. There were still 20 to 30 papers which went through full text screening, and we really identified one paper which did reach our inclusion criteria. However, yet it did not specifically look into the association between any eco-emotion and suicidality on individual level, but it was focusing actually on climate change, mental health, and how it's what are the extras or what are the challenges when it comes to the mental health professionals. So, and that's paper by Hopper, comes from Minnesota, and it did include 517 practicing mental health professionals. And it's, of course, the study did not specifically focus on suicidality. The main focus was really on mental health and the climate change-related mental health, and how does that impact mental health professionals, their practices, and what have they observed in their practices. And 82% agreed that the climate change is an important problem which does impact mental health. And many of the mental health professionals reported impacts, and their list actually did include one mental health related outcome, which was that asking about climate change related concerns, including suicidal ideation and attempts. And to that question, 22%, so approximately 1/5 of practicing mental health professionals reported that they had seen evidence of suicidal ideation and attempts in their clients as an outcome of climate change. So the question was specifically targeting that it needs to be linked to the climate change. So unfortunately, that was the only study, but so far is currently out there, as we did run our searches in September 2023. And of course, here there is great potential, and many existing surveys, actually even on the national level, may already include some questions around also around climate worry or similar concepts. Sometimes there is only one of questions, such as, have you been worried about climate change? Have you been worried about the environment? And of course, now here and overall across all these studies, the problematic part, what we're facing when we are comparing different studies in research and when we are running systematic reviews or particularly meta-analysis, is the fact that there are so many different definitions, and especially in new fields, and also the problems with different tools with what we are measuring those new concepts. So now where to from here?